Good afternoon, Miller Brown. Let's begin the warm-up session. Why did you choose to become a nurse?
There are several reasons why I chose nursing. First of all, many of my relatives are nurses and their stories inspired me a lot. Besides, nursing is a profession with an ocean of opportunities both native and abroad. Above all, this is a service-oriented profession in which I can serve humanity. Hence I chose nursing as my career.
Why did you choose OT?
It is my long-term ambition to work as a registered nurse in any English-speaking country such as the UK, Ireland, and so on. To meet the requirements to register as a nursing professional there, I need to prove my English language proficiency. Hence I choose OET to fulfill my dream. Moreover, OET is tailored according to the needs of nursing professionals, therefore I believe I could perform well in this test.
What are the current trends in your profession?
Nursing is a dynamic profession and changes happen daily. Nowadays technology plays a vital role in my profession. For instance, paper records that we used in older days have been updated to electronic records. Besides, at present, we are following evidence-based practice, which means there is a scientific rationale for every procedure. Moreover, in present days a nurse can function as a nurse practitioner, which is equivalent to the position of a physician.
Do you have a role model?
Yes, I do. My role model is my mother. I follow many things that my mother does. It is from my mother I learned the basics of kind behavior, decision-making, and organizing skills, a polite and humble manner, helping and sharing mentality. The care and respect she gives to everyone makes me wonder sometimes. She is a perfect example of womanhood. I believe a nurse should possess all these qualities. She is my superhero.
Which is your favorite destination? Why?
My dream destination is Australia. The first and foremost thing is that Australia has a world-class healthcare system and I can be a part of it. Secondly, the country has a better standard of living and economic and political stability. Besides, here nurses are paid well and respected too. In addition, I have many friends and relatives over there, so they can help me during my initial days.
Your preparation time is over. Please start your OET-speaking roleplay.
Hello, Mihiraa. I am your attending nurse Miller Brown. May I know the reason for your today's visit?
Good morning, Nurse Brown. Yes, I just want to make sure I'm doing everything right to help him heal. Could you tell me about what I need to do for his care at home?
Of course, Mihiraa. I can see you've had a busy few days with Ryan's surgery, and it's completely understandable that you have questions. Surgery can be a lot to handle, especially for a little one. You're in the right place, and I'm here to help make this part of the journey smoother for you both. For the first few weeks, it's essential to keep your child's ears dry to protect the healing area. When bathing them, take care to avoid water near his ears. Instead, gentle cleaning of the outer ear with a soft cloth is all that's needed for now. Though infections are uncommon, it's wise to monitor for any signs. If you see any of these, please reach out to your doctor without delay. Managing any discomfort is also important. If your child seems uncomfortable, follow your doctor's advice. Finally, follow-up appointments are essential to track recovery and ensure everything is healing as it should.
Got it. I'm also wondering, how should I handle his pain if he seems uncomfortable?
That's a great question, Mihiraa. Managing Ryan's pain effectively will help him stay comfortable and recover more smoothly. For mild pain, you can give him paracetamol. This is generally safe for young children, but it's always best to double-check the dosage instructions based on his weight and age and make sure he has no allergies. Keeping his routine as calm and comfortable as possible, along with regular pain management if needed, should help him feel better soon. I hope it is clear to you. Do you have any concerns or questions?
Yes, it does. Thank you. I'm a bit worried about infection, though. I've read that it's still possible after grommet surgery. How common is that?
I understand your concern, Mihiraa. It's normal to feel a bit anxious about infections after surgery. Fortunately, infections after grommet insertion are quite rare, especially if we take the necessary precautions. As long as we're keeping his ears dry and clean, the risk is very low. However, it's still essential to watch for any signs that might indicate an infection, such as yellowish discharge, redness around the ears, fever, or if Ryan seems more irritable or in pain than expected. If any of these symptoms appear, please don't hesitate to contact us or your doctor for advice. Early attention is key if there's any sign of infection.
That's reassuring. And how long do you think it will take before he's back to his normal self?
You're doing great, Mihiraa, and you're almost through this part. Recovery from grommet surgery is usually quite quick. Most children feel back to normal within a day or two and regain their usual energy levels pretty soon. However, for the next few days, it's best to keep his activities light and avoid anything too vigorous. So, no rough play or intense physical activities until he's fully back to himself, just to allow his body to complete the healing process.
Thank you for explaining that. I'll keep an eye on him. Will he need any follow-up checkups?
Yes, Mihiraa, follow-up checkups are essential. These appointments allow his doctor to check that the grommets are functioning well and that there's no fluid buildup or other issues affecting his hearing. Hearing tests may also be part of these follow-ups, ensuring that his hearing improves as intended from the surgery. I encourage you to stick with these appointments, as they'll help make sure Ryan's recovery continues smoothly and enable any needed adjustments along the way.
Thank you for your support.
My pleasure. Mihiraa, let me quickly recap everything we've discussed to make sure it's all clear. First, we talked about the importance of keeping Ryan's ears dry to prevent infections. For the next few weeks, try to avoid getting water into his ears while he's bathing. You can gently clean around the outside of his ears with a soft cloth, but avoid putting any water inside. Using earplugs or a waterproof headband during baths can help prevent water from splashing into his ears. We also discussed the signs of infection, which, while rare after grommet surgery, are still something to watch for. Keep an eye out for symptoms like yellow or green discharge, redness around his ear, fever, or increased irritability. If you notice any of these, please contact his doctor right away so we can address any concerns early. For pain management, I recommend giving Ryan a mild pain reliever like paracetamol, but make sure to follow the correct dosage based on his age and weight. Also, keeping his environment calm and soothing can help him feel more comfortable during his recovery. We talked about limiting his physical activity as well. For the first few days after surgery, stick to light activities and avoid intense physical activity or rough play. This will help his body heal properly without additional strain. Lastly, remember that follow-up appointments are very important. These checkups will help ensure the grommets are working well and there's no fluid buildup affecting his hearing. Regular visits will also allow his doctor to track his progress and make adjustments if needed. I hope this summary helps. I wish Ryan a speedy and healthy recovery.